We're rallying in our own time in response to the New South Wales Government's rejection of any improvements to our state award.
1.04 is not enough. Look at how much work we are doing on a day-to-day basis, and we believe that the government can offer something better.
We find ourselves constantly understaffed, begging for adequate staffing. We don't have ratios in mental health and we think we need them as well, same as the general hospital, same as every other health service.
Ratios in mental health would definitely make a big difference because you are looking at patient care, patient safety. I work in ED, so seeing patients coming in every day, there is so much distress because of the pandemic. People have lost their jobs. There is domestic violence. We have had probably almost like treble the number that normally comes in.
We have widespread violence and aggression in mental health. A lot of us, don't know whether we'll come home without injuries. A lot of us are traumatised, burnt out, exhausted, and having those mandated ratios would allow us to do our job properly and make sure that people aren't just going through the revolving door healthcare system and getting the care that they need so that they can be prepared to get back on their feet.
We have relied on the work that you guys do, keeping our health system going day in, day out, and to just offer 1.04%. It's an insult.
There's not enough staffing at the moment. As a midwife, we want the ratio to be 4:1, and at the moment in maternity ward it's 6:1, but if you count the babies, that's 12:1. The babies need to be monitored, have their obs done. The mums need help, especially first-time mums. And quite often when it's busy, the women miss out on the care they deserve.
We're here today really working to get enough nurses on the floor to take care of all our patients so everyone's properly looked after.
Patients of small community hospitals deserve same nursing hours as those of a large teaching hospital.
What do we want?
If you want to have a quality healthcare system and you want patients to be cared for safely, you've got to have the right number of staff with the right skills in the right place at the right time.
I feel just sort of ignored after everything that we've done, like, oh, is this the thanks that we get? You might as well just clap.
We are now seeing our nurses and midwives leave the system because they can't take it anymore. They don't see any sign of it improving.
I look around here, I see a number of staff from Cumberland Hospital. I know every single one of them has been hospitalised by a patient in the past. Some of them quite seriously.
ED is pretty much a battleground and it has been for several years. It's been progressively getting worse. Every day we are working up patients and seeing patients in unsafe locations. We're having to treat patients in the ambulance bay, in corridors. The rest of our patients, 40 or 50 of them, will be sitting out in the waiting room and that's where they'll spend their entire ED stay.
We've got a nice new building behind me. That doesn't mean we've got more beds for you. That just means the wards and patients have been shuffled. It's a musical chair. We want ratios.
Our ratios haven't changed in ED in decades and our patients have become sicker, our workload has increased.
Government does not provide the support we need, the nurses we need, then we can't do it. It's as simple as that. We need the extra nurses so we can make sure the patients get the care they deserve.
We're not taking any more. They are not going to walk over us and run their system on our backs. It's just not on. Enough is enough.